Aphasia. This is the most frequently heard concepts in the field of psycholinguistics. In order to have a clear understanding on this particular topic, these are the questions we must address first. What is aphasia? What are the causes of aphasia? What are the possible symptoms of aphasia? What is the treatment of aphasia? Let's get started by the most basic question. What is aphasia? Aphasia is a language disorder and a condition that restricts a person from the ability to communicate successfully. At a higher level, it may harm the understanding of both comprehension and production of language. Let's move on to the next question. What is the reason of aphasia? Or what are the causes of aphasia? Aphasia can be the result of a stroke, blockage, or rupture of blood vessel in the brain. Thereafter, the loss of blood to the brain leads to death of brain cells. Besides, tumor, infection, or a degenerative process can cause aphasia. Of course, aphasia can be the result of a severe external head injury. Now look at the next question. How to identify aphasia? Or what are the possible symptoms of aphasia? The symptoms can vary from the basis of severity of damage. Yet, the most common symptoms of aphasia are not being able to speak in long sentences, speak in sentences that do not make sense, substitute one word for another, not being able to understand interlocutor's conversation, write sentences that do not make sense. At last, let's take a look at the most solid question. What is the treatment of aphasia? The treatment of aphasia must be started right after the stroke or injury. Certainly, the treatment will vary on the basis of severity of damage. Nevertheless, the most common and effective treatment of aphasia is speech and language therapy. The interlocutors should be cooperative enough to help the patient relearn and practice language skills. At last, a person with aphasia can be soothed because aphasia does not affect a person's intelligence.